Welcome to this presentation on the Certified in Public Health Credential. I'd like to welcome you on behalf of the National Board of Public Health Examiners Board of Directors. As you can see, our leadership is comprised of representatives from many different organizations representing accreditation, education, and practice in public health. So the CPH, the Certified in Public Health Credential, has been around since 2008, and we've grown a lot since that time. We've hit a number of really exciting milestones, including over 10,000 examinees. We've had candidates test in almost 100 countries, and we now have 12 schools and programs which require the CPH exam. So let's talk just for a moment about why should you get certified. If you're here, you must be interested. So I'm going to share a little more information about how certifications are important to the field. So this slide shows the three legs of the stool of any profession. Most professions have all three components. We'll start at the top with accreditation. So accreditation is the approval of institutions. There's a process they must go through, and they must meet certain standards set by their peers. And the institutions, such as a hospital or a health department or a university, must be accredited. So credentials, and the bottom right, are degree programs or certificate programs. They are credentials that are usually offered by institutions of higher education. And certainly we've had credentials in public health for some time. We've got many degrees going back over 100 years. So the third leg of the stool is licensure and certification, and it's similar to accreditation, but licensure or certification is specific to an individual. So remember, accreditation is for institutions such as a school of public health or a public health department. A certification is for an individual. And until 2008, we didn't have a certification in public health. So we like to look at the way certifications complement formal education or work experience. So these are a couple of examples that might be familiar to you and might help you understand the power of a certification in public health. An accountant, for example typically has a lot of coursework in accounting, but they also sit for a standardized exam and become a CPA. Board certified physicians certainly have a medical degree, but they also sit for a board exam. That's basically the way the CPH works. So individuals have lots and lots of reasons why they become certified in public health. We have a number of people who get certified in public health because they believe it's important to the field of public health and they want to move the field forward. We also have individuals who believe that having a certification in public health will make them more competitive in the job market or in their job. And then finally, we have lots of individuals who just love a challenge. They like the recertification process so that it forces them to stay current in the field every year. And they just really believe in certification programs. So what I'm going to do now is I'm going to play you a short video. We had a number of CPHs come into our office and they told us why they got certified in public health.
I graduated with my MPH 2 years ago, and I knew that I wanted to be certified in public health. My employer was thrilled to see that I have my CPH because they know that I'm a lifelong learner and I will continue to build my skill set.
I'm from an underserved community. I'm from Mississippi originally. That's why I decided to pursue a master's degree in public health, and I earned that a couple of years ago. And now with the certification in public health, the communities I serve will know that I'm up to date, I'm keeping up with my education, and I'm striving harder, and it will benefit those communities.
After returning from the Peace Corps, it was important to me to continue my public health education. As a community health volunteer in a rural village, I worked closely with decision makers and other community health volunteers. The CPH allows me to enhance my skill set through continuing education credits.
I took the CPH exam and got certified in public health as a self-affirmation of the knowledge and skills that I had received during my Master of Public Health program in Policy and Management. It was a fantastic way to share with my family and friends what I had learned during my 2-year program. It was also a great way for me to share with the general public that I care about my continuing education and want to advance the field of public health.
Even though my coursework provided me with the essential fundamentals of public health goals and initiatives, getting certified will help me excel in my work beyond the classroom to the broader hands-on field of public health, advancing my career as a public health professional.
I see the CPH as an opportunity to recommit myself to the field of public health and to renew my knowledge in all core areas, especially those that I don't get a chance to practice on a regular basis.
Getting certified in public health is a way for me to show my dedication to my profession and to also show that I'm up to date in the profession and I know what is happening and I can do my job.
So one question we often get is, do employers require the CPH? And so remember, the CPH has only been around since 2008. So a lot of employers haven't had the opportunity to see a lot of resumes from CPH. We're definitely newer in the field than many other certification programs. So what I'm first going to do is start from a very high level and explain how employers value certifications in general. So the Institute of Credentialing Excellence polled a number of employers and those that held a credential and asked them what they thought the benefits of certification are. And so certainly you can see from these slides that they thought very favorably that a certification helps them in their jobs and to go further in the profession. These are some of the most common reasons. They believe that certifications help prepare and challenge face the challenges in their profession. And here you can see that folks who have a certification really believe that it helps them to move forward in the field. And lastly, you can see all the reasons why folks who have a certification feel that certifications are important. So in public health, as I mentioned, the CPH is a fairly new certification. However, many employers are starting to pay attention. And if you're an employer, you're not likely going to require the CPH if you don't see a lot of resumes with the CPH. But what we are finding is that many employers, when they're starting to see CPHs, start requiring the CPH, and then job candidates think, oh, maybe I should get my CPH. And it's really growing and spreading on a local level. So there are some states where we have lots and lots of jobs require the CPH. Typically those jobs where we have somebody or have a school or program that requires the CPH. So what you see here, we partner with the Association of Schools and Programs of Public Health. They have a website called Public Health Jobs, and it's a job site for public health positions. And we do look periodically to say which employers on that particular job site are requiring the CPH. And you can see it really runs the gamut of state-based public health, nonprofits, universities, federal government. So we do keep an eye on that. And the trend is that more and more employers are requiring the CPH. So we're going to take a look at the overall certification process. So we'll start with eligibility. So the first step is to determine that you're eligible, and then you'll apply and we will approve your eligibility. And I'll go through these criteria in a moment. The next step is once you are approved, you can sit for the CPH exam, and you must pass the CPH exam in order to be certified in public health. And the last step is once you have your CPH, you do need to maintain your CPH through periodic recertification, and you must adhere to our code of ethics. So now we'll look at eligibility. So we have three basic routes to eligibility. The first is any graduate of a CPH accredited or CPH applicant school or program. So if your school or program, that degree program is CPH accredited and you graduated before the original accreditation date, then you are eligible to sit for the CPH exam. Likewise, if you are a student of a CPH accredited or CPH applicant school or program at the graduate level, then you are eligible to take the exam. In this case, your school would have to let us know when you can take the exam. They typically don't approve applications from students who haven't taken much coursework yet, but at some point during your degree program, you would be able to take the CPH exam. And if you pass, you are provisionally CPH until you graduate, and then you become fully certified in public health. And the last criteria is work experience. And there are a couple branches to this experience, but basically it allows public health professionals who do not have a CPH accredited school degree program to sit for the CPH exam. So the first branch of this eligibility is if you have a bachelor's degree in any area. It does not matter what the topic area is, as long as you have a bachelor's degree and you have at least 5 years work experience in public health, you can sit for the exam. We also have a criteria for anybody who has a graduate level degree that's not CPH accredited, but it's related to public health and at least 3 years work experience in public health. And we also have a eligibility criteria for candidates who have completed a public health certificate program from CPH accredited schools and programs, and they have at least 3 years work experience in public health. So once you're ready to apply for the CPH exam, you'll go to our registration system, and it's a very streamlined system, makes it very easy to get through. You'll go to Get Certified on our homepage, and you'll end up on our Apply Now page. And I'll point out here, there's lots of helpful links. You can look at our eligibility, you can look through our candidate handbook. If you are thinking about taking the exam by a computer-based testing center, you can search for a location there, etc. This is basically how the process works. When students and alumni apply to take the CPH exam, their school or program immediately gets an email message that lets the administrator know that they have a candidate who's interested in taking the CPH exam. If you apply under work experience criteria, we send your application out to a review committee. They get an email notification letting them know they need to review the criteria. So once your application is approved by your school or program, you should get an email immediately from our testing partner, Scantron, letting you know you can schedule your exam. If you've applied and you haven't been approved by maybe about 2 weeks, then certainly send us an email and we will follow up and find out what the delay is and try to get your application to be approved. But give it about 2 weeks so that it can get through our process. So once you receive the scheduling instructions from Scantron, you can schedule right away. You can actually schedule as soon as 72 hours later if you're ready. If you're not ready, no worries. You can take as long as you want. We actually do not have a deadline, so candidates can wait as long as they want before they take the CPH exam. You will never time out. So our exam fee structure, you can see here, the standard fee is $385, but we do try really hard to make it affordable to candidates. So we have a number of discount programs. We have partnerships with a number of schools and programs and employers and membership organizations. So if you go to our website and you look at fees and discounts, you can see if you qualify for a $70 discount. And lastly, we also have an even steeper discount for students and alumni of schools and programs that require the CPH exam. So these are the schools and programs that currently require the CPH exam. And if you're attending any of these institutions, I'm sure you've heard quite a bit more about it. If you're an alumni, you've already graduated and you didn't know about this requirement, the good news is you will automatically be eligible for the discount and pay the $250 exam fee. So the exam itself is a 4-hour exam with 200 questions. You get a 4-hour block. The average candidate takes a little over 3 hours, but you've got a full 4-hour block in case you need it. All the questions are multiple choice and single best answer. So we test all year long. You can take the exam any day of the year. We do not have testing windows. And we offer 2 options for testing for the CPH exam. We do have a large network of testing centers that are typically open Monday through Saturday, and you can search for their availability on our website. We also have live online Proctor, which is a newer option for us, and it allows you to take the CPH exam for your own computer. You just need to have a private space that's quiet. You need to have a camera and a mic, and then we will link you up with a proctor who will be with you the entire time you take the CPH exam. As soon as you complete your exam, whether it's by live online Proctor at a computer-based testing center, you'll receive your scores. You'll not only know if you passed or failed, but you'll also know how you did across our domains. And we'd like to note, if you take the exam as a student or alumni, your school or program will receive your scores. So they can see how you did on the exam, not just pass, fail, but they will also see how you did across the content areas. And the reason for that is twofold. One is if the schools and programs which are requiring the exam are basing their graduation decisions based on your success on the CPH exam, they need to see your scores. But we also find that schools and programs find it really useful to see in the aggregate, how are their students doing? How are their alumni doing? Because it gives them a lot of helpful information. They can compare their aggregate scores with those of other schools and programs and determine maybe their student body is overperforming or underperforming in some of the domains. Now, if you apply under our work experience criteria, the only people who have access to your scores would be the CPH staff and you. We do not share your scores with anybody if you apply under our work experience criteria. We do have a registry on our website, so folks can go through and they can find active CPH. If you're not an active CPH, then you will not appear. So if you've lapsed, if you failed, you will not appear. Nobody has to know, but this is a great way for employers to verify the active status of their employees. So this slide shows the pass rate of the exam. This is not the cut score, this is the pass rate. So how many people pass the exam every cycle? And you can see it goes out up and down a bit. And a lot of that has to do with the strength of the candidate pool. So sometimes when we're opening a new eligibility, it's new for that candidate pool and they may not perform as well the first time. But overall, you can see the pass score is an average of just over 80%. So when you pass, we will mail you a certificate that you can hang in your office, and you can also buy a frame from one of our partners if you wish. But we also will send you a customized URL for a virtual certificate that you can add to your LinkedIn page or a link to your email signature, and anybody that you work with online will be able to learn more about the CPH. So for candidates that do not pass the exam, they can take the exam as many times as they want and as soon as they want. We don't have a waiting period for retesting. And the price for retaking the exam is $150 each attempt. So all you do is just log back into our website and it'll ask if you want to take the exam again. So we're going to take a look at the content outline, which is the map of all the areas that we test for the CPH exam. So we developed our content outline by going through a job task analysis, which I'm sure many of you are familiar with job task analysis, but for those who are not, it's used for many different reasons, whether it's creating job descriptions or assessing the workforce. In our case, we use it to make sure that we are testing on what people actually do in public health. So we assemble a committee and they put together a survey that we administer to as many people as we can in public health. And what we ask them is, how often do they perform tasks that we believe are common across public health? And the last job task analysis was 200 job tasks, and we asked the respondents to rate how often they perform these tasks. We got almost 8,000 initial responses, and we couldn't include them all. So we ended up with nearly 5,000 useful responses, which we were just thrilled with. We took a long time to analyze what did it mean. This had never been done in public health before. So we partnered with lots of different organizations really to make sure that what we found, what we believe were the common tasks in public health that most people were doing, were indeed resonating with our partners. So these are the most recent domains of the CPH exam. They are evidence-based approaches to public health, communication, leadership, law and ethics, public health biology and human disease risk, collaboration and partnership, program planning and evaluation, program management, policy and public health, health equity, and social justice. So each of these domains, think of it like a chapter in a book. Within each domain, we have many, many sub-items and subtopics, but these are basically how our exam questions are organized. So I'd also like to note, you might have noticed some of those domains and you think, that's not an area that I'm very strong in. That's okay. We score passing and failing on the CPH exam across all scores. We add them up and you have a total score you must meet. We do not score in each domain. So if you have a domain where you're not quite as strong as others, that's okay. You can still pass the CPH exam. We also spent a lot of time on developing a high quality exam. There are industry standards that every certification body follows, and certainly we do as well. So we make sure that our exam questions are vetted and analyzed, and we have good statistics with psychometricians that help us develop our exam. And once you're certified, you'll actually be invited, if you wish, to join us in writing items for our new exams. So just about everybody has to study a little bit, if not a lot, to prepare for the exam. So I'm going to walk you through some of our study resources that we have. So on our website, we have a page called CPH Study Resources. So if you go to get certified, there's a drop-down menu. It'll take you to Study Resources, and you can find all the links here. So this is how we suggest you prepare for the CPH exam. First, I would go to the CPH content outline and just scan it. It's a long document. It's all those domains, those 10 domains that I showed you earlier, plus all the tasks that are relevant to those domains. Just scan it at first. And what I think you'll find is you'll see some domains and think, this is what I do at work, or, oh yes, I studied this in school. Then you'll probably see a few domains where you think, I never took a class in that, or I don't know anything about this domain. And in that case, it's up to you how you decide to study, but we suggest you might want to study with the domains you have the least familiarity. So we also have a set of sample questions. I believe it's 10 sample questions in a PDF format. And so the purpose of this short set of sample questions is purely to give you an idea of how do we write our questions? What do they look like? How complex are they? How many answer options do they have? So you can just take a quick look at those, just kind of get a sense of how our exam will appear when you take it. But if you're thinking about doing some self-assessment, then I really encourage you to take our practice exam. So we actually, a number of years ago, retired some questions out of our CPH item bank, and we launched these questions into a mini exam. So they're real questions that'll never appear on an exam again. But it mimics the testing environment, and it'll really give you a good idea for what it's going to feel like to take the CPH exam. And after you take the mini exam, you'll get your results back. So you'll know where you have trouble spots and where you don't. And if you really want to get a sense of the pace for the exam, remember the actual CPH exam is 200 questions and it's 4 hours. So you might want to try taking the mini exam 50 questions, so try taking it in 1 hour. So you also get a sense of the pace. How quickly do you need to answer the questions? And we are planning on launching a second mini exam sometime this summer. So we partner with a number of other organizations that make study materials available. So the first is we partner with ASPPH, and every couple of years they host webinars on each of the domains. So the last round of webinars was archived and is available free on our study resources page. They're really terrific resources. We get very good reviews from them. We had faculty and practitioners go through the basics about each of the domain and really talk more about what you should need to know about each of the domains. So they are free and available online. ASPPH also has a CPH study guide that they developed independently. None of the questions will actually appear on the CPH exam, but they followed our content outline and developed an online study guide. So if you feel like you just need more practice, this is a great resource because it's very heavy in practice questions, and it's also interactive. Some of the questions, after you answer them, a video will pop up and explain why a question answer option was right or wrong. So APHA Press put together a study guide a couple of years ago, and this is a really nice companion to the ASPPH study guide because this is a book that you can purchase, and there is an overview of each of the domains. So if you feel like you just need to learn a little more about the domains and get some basic information, this study guide is terrific. And we're glad to say we also have a third study guide now. Springer Publisher put out a study guide last year as well. And so this also is a terrific resource if you just need more practice questions so that you can figure out where you need to continue learning so you can be successful on the CPH exam. So APHA typically partners with us every fall. And so we have a certified in public health review course. So it's basically a learning institute. So last year, as you can see, the Learning Institute was online. It was actually 2 days for 4 hours each, and we brought faculty in, and they worked with candidates and went through the basics of each of the domains and did some practice question sessions. And we are hoping to have a very similar Learning Institute this year. We're not sure yet whether it will be in person or online. So now I'd like to talk to you about the recertification process. So after you pass the exam and you're fully certified in public health, you do need to maintain your certification through a recertification process. And our process is a little different than other certifications. So first, the basics. You have to report 50 recertification credits every 2 years. It's $95 every time you report every 2 years. And you just log into an online reporting portal and tell us all the activities you've completed over the last 2 years. So the way that our recertification process is different, one is that we allow CPHs to report all kinds of activities that typically don't appear with other certifications. You can certainly go to a conference or a professional event, but you don't have to. We wanted to make this recertification process cost-friendly and accessible. So you can do online education, podcasts, webinars. We also give credit for a number of things that you might do that are related to your job, such as publishing journal articles, writing a grant that is approved. One of the activities I'm really proud of is volunteer leadership service. So if you do work with an organization outside of your position on a volunteer basis that's related to public health, you can get credit for that. And as you can see, we also give credit for being an item writer, CPHA accreditation, medical residencies or other health residencies. And lastly, this year, we are giving credits for work in direct response to COVID-19, just to give some relief to our CPHs who are really on the front line of dealing with the COVID. So the other area that makes us different than other recertification processes for other credentials is we do not have a pre-approved provider process. We did not want a fee to providers to be a barrier, and we also want to give CPHs the flexibility to determine what activities they want to report. So you can report any activity as long as it meets our guidelines, and we have a much more specific guideline list on our website. As long as it meets our guidelines and it's related to public health, it will count. It does not matter if we know who the provider is and we do not pre-approve those activities. As long as it meets the guideline and it's related to public health, it will count. So this is just a screenshot of what our portal looks like, and it just makes it easier to track where you are, how many credits you have to report. We certainly don't want you to be surprised. And if you need an extension, then you can certainly extend your cycle so you can get a little more time to report missing credits. We also partner with a couple different organizations that have activity finders, just in case you are short credits and you just need to find out where you can earn more credits. You don't have any ideas, you can go to one of these 3 sites, and it's just a handy way to find opportunities to earn credits. And we also try to make it a little fun. So we offer digital badges. So the more recertification credits you earn, the more badges you'll earn in our portal. And certainly, if you get your CPH, that's a huge accomplishment. So we hope you'll visit our merchandise store, maybe buy a coffee mug, so your coworkers will ask you what your new credential is all about. And we also invite all new CPHs to join our book club. We currently have over 1,000 members to our book club. We have an active advisory committee that determines which books that we're reading. We often have the authors of the books join us for an online session or in person. So we'll get an email about that once you are fully certified in public health. And lastly, we hope you'll stay connected to other CPHs through LinkedIn. And that's really the point of the CPH, is to create a profession, and for every profession you need to have a community. So we'll also invite you to join our LinkedIn group. So I hope this has been helpful for you. Here is an email address. If you have any questions, we'd love to hear from you. So just shoot us a note at any time, and hopefully we'll see you online soon. Take care.